Hi everyone, I'm Dr. Charmaine Johnson from Premier Smile Center. Today I want to go over a couple of tips and tricks with keeping everything nice and clean at home. There's more and more people having to work from home. Schools are out, so I feel like now's the best time. There's more than enough time to go over your daily routine. It's even more important at this time to be able to maintain, because the problem we have is that we want to try and keep everybody healthy, and keeping everybody healthy means making sure there's no infections, making sure that the gum disease is under control, and maintaining is one of the most important things. So as you know, the first thing is brushing. You can use a manual toothbrush or you can use an electric toothbrush. What I have here is a Sonicare electric toothbrush. It has many settings on it: gum care, regular cleaning, a whitening mode. And the most important thing about these electric toothbrushes is that they have a timer on it. So it will stop by itself anywhere between 2 minutes or 3 minutes, depending on the setting you have. You can use a manual toothbrush, that's fine, but the principles are all the same. So the bottom line is, if this is a model of your teeth, whether it's a manual toothbrush or an electric toothbrush, you must place the bristles half on the tooth and half on the gum like this. With an electric toothbrush, you'll see how it'll just do the brushing for you, and you just rest it at this zone and keep moving it along every couple of seconds per tooth. Same thing for the inside. You're going to hold the tip of the bristles are going to be touching the gum tissue here, and you're going to move it all the way back, staying along the gum line, as you can see. Okay, and then obviously for the bottom, exactly the same. And the most important thing with this is that you do not stop the brushing midway. Just allow it to brush and stop by itself, because the biggest problem people make when they're actually using a manual toothbrush is, number one, they're not brushing for long enough. Number two, they're not positioning it half on the tooth and half on the gum. And number three, they're scrubbing. So as you can see here, what they're doing is they're just scrubbing like this. And you really want to do soft, gentle bristles. It's a gentle brushing technique, and your bristles or your brush head needs to be as small as you can get it with the soft bristle heads. So you're going to do that twice a day, spending at least 2 to 3 minutes brushing. Now you've got to be able to get in between the teeth as well. Most commonly we will use floss. If you find floss difficult to use and wrapping it around your fingers, these are called floss picks. And a floss pick basically is floss suspended between two ends, and you're actually going to go in between the teeth and rub it up on both ends and come out. It's important not to just go in and out, and you want to brush, you want to rub here and come out. Okay, so you can use floss picks, go from the back all the way to the other side. Same thing for the bottom. If you find that difficult to do, or you have very tight contacts between the teeth, then you can use these Proxy brushes. So Proxy brushes are basically a little bottle brush. You can bend them to get to hard to reach places, but you put them in between the teeth like a toothpick, and you're just going in and out just like that. Okay, they come in different sizes. If you have tight spaces between the teeth, then you're going to use the ultra tight. If you have large spaces between your teeth, you're going to use the wide. So I would suggest you get a bunch of different sizes and you try them into the space, because you want to use the largest size for the space that you have, and that will help to clean in between the teeth. What I always suggest after you've done that is what we call a water pick. I have so many patients tell me that they brush their floss, and when they water pick afterwards, there's still stuff that comes out. So water pick has a water reservoir here, and you want to use the tip that is pointed, because you're going to put that in between the teeth, just in between, and you're going to shoot the water through. So it's like a pressure cleaner, but for your teeth, and you're going to shoot the water through so that the water comes out through the other side, and you'll find that stuff will still come out. What you can put in the canister is either water, or during this time, during coronavirus, the best thing is mixing hydrogen peroxide in it. So you purchase hydrogen peroxide, it's 3% when you purchase it from the store, and you want to use 1%. So you're going to dilute 1 part of hydrogen peroxide with 2 parts of water. And that's what you're going to put in your canister. You'll shoot that through and it'll help kill the bacteria as well. So those are the 3 major things in terms of mouthwashes. If you are a gum disease patient, the Peridex mouthwash, which is the brown bottle that's prescription, is what you're going to use. And then you can still use the hydrogen peroxide in your water pick, because the hydrogen peroxide in its oxidative process basically will break up the cell wall of the coronavirus. So that's mouthwashes. In terms of toothpaste, it doesn't matter what toothpaste you use. All the toothpaste that are commercially out there have fluoride in it, and it's the fluoride content that you want. So it doesn't matter which one you use, that's fine. So I hope that helps. Please share this with everybody that you know, so that you can get the word out there, especially at this time where we don't know what's happening. We might have to stay in, whatever the case may be. It's the perfect time to be able to make sure you maintain well and you prevent infections from happening. Give us a call if you have any questions regarding anything that's related to you. Our number is 954-566-7479. Thanks.